Good afternoon, everyone. This is Dr. Jeff Gelblum, neurologist here at First Choice Neurology. My office is located in Aventura, Florida. And for many of you, this is a friendly follow-up visit. You and I have had several discussions on the Facebook Live video format. We've discussed things like how to get tested for COVID, what is COVID, how does COVID interfere with the pulmonary system, with the immune system. So we've had lots of very interesting discussions, and hopefully the information that I've shared with you has helped you navigate this very dangerous and scary pandemic that we've all been experiencing over the past several weeks. So, purpose of today's discussion is to talk about HIPAA compliance, HIPAA. What is HIPAA compliance? Well, HIPAA, Health Information Portability and Privacy Act, is a federal statute that was established in 1996, signed into law by President Clinton, and then reaffirmed in 2003 under President Bush. And the purpose of this is to make sure that any platform whereby me as your doctor and you as your patient, or the hospital or the insurance company, any platform whereby we engage, we interact, we consult, that is all super private. Because as you can imagine, in this day of Zoom bombing and hacking and internet availability, there is an extraordinary risk of leakage when it comes to discussing medical problems with your doctor. And the reason why this is such an important topic for today is because HIPAA compliance is more important than ever. Right now, in the midst of the corona pandemic, many of you are engaging in telehealth consultations with your doctor. I know in my office here in Aventura, Florida, we do pretty much 20 to 25 televisits every single day, taking care of our patients who have various neurological conditions. Obviously, we don't want them leaving home. We want them sheltering in place, so we come in via a telehealth platform. But it's always important for everyone to remember that however you interface with your doctor, with your nurse, with your insurance company, or with your hospital, that all of these interfaces, all of these encounters be what's called HIPAA compliant. So many of us recently celebrated Passover, and we had a nice Seder on Zoom. Is that HIPAA compliant? Absolutely not. In fact, there's this whole concept now of Zoom bombing, where you'll have a business meeting or you'll have a family get together, and then whoop, suddenly you come in and there's a picture of a scary ghost or something even worse. It's imperative that when you are scheduling a virtual visit with your doctor, that you always make sure that that visit is HIPAA compliant, HIPAA, because what that means is that the platform in which the entire televisit takes hold, that platform is entirely private and is secure from hacking. And this is a very big issue right now, because the federal government has recently eased up on all of the ways that you as a patient can go and see your doctor. You can go on MobileMe, FaceTime, Zoom, Skype. And I want to remind you that these platforms are not HIPAA compliant. When you have an appointment in our office, for example, we use a specific intranet platform, which might be a little bit irritating to some folks because it's not as simple as just clicking on a Zoom link. But this platform assures that you are being treated, seen, evaluated in a very private way. And that's imperative to make sure that your personal information, your social security number, your telephone, your date of birth, your address, that these types of very important identifiers of your identity do not end up somewhere out there on the internet for fraud and abuse. So HIPAA compliance is an extraordinary component of medical care. When you go to the doctor, everything in our office is HIPAA compliant. When you and I have a conversation across the desk, everything by definition is HIPAA compliant. When you transition into the internet, into the televisit, telehealth format, you must make very certain that that interaction with your healthcare provider is also HIPAA compliant. In our office, we know of two formats that are HIPAA compliant. We use our telehealth modality called ECW, Electronic Clinical Works, ECW, which is our health information system, and that has built into it its own telehealth component. There's another one out there called DoxyMe, DOXY.me. So, for example, in our office, let's say you have a 1 o'clock telehealth visit that's scheduled through my secretary. At approximately 12:45, you would get that little signal coming up on your phone from our system, from Dr. Jeff Gelblum at First Choice Neurology, and it would say, click this link at 1 o'clock when you're ready to enter in to the televisit setting. So that is an extraordinarily HIPAA-compliant fashion, and it allows us not only to take your information that you're telling me in the televisit and directly apply it within your health record, but it also assures that this is hack-proof. The other platform that's available out there is called DoxyMe. These are the two big ones. If you are being Zoomed into your doctor's office, if you are being FaceTimed into your doctor's office, if you're just going on the telephone and saying, hey, can we do a video chat right now, that is not HIPAA compliant. And that is a big problem for many patients and for many doctors, because essentially what it does is it exposes your entire health record to the entire world. So therefore, when you are scheduling a telehealth or televisit or any other type of encounter in a virtual format with your healthcare provider, after getting the schedule and saying, hey, I've got an appointment next Thursday at 1, thank you very much, you need to always ask that practitioner, is this platform HIPAA compliant? Right now, there's an extraordinary amount of fraud and abuse going on because of the COVID pandemic. And as I always say, when the going gets rough, you always see a lot of cockroaches come out of the wall. And there's a lot of people who are looking to scam and take advantage of our vulnerabilities during the corona pandemic. And the healthcare industry is very attuned to this. And we practitioners who've been doing telehealth for quite some time are very, very familiar with what it takes to maintain a HIPAA compliant, a completely private encounter between you and me. For those docs that are not so facile or adroit with the televisit format, this is something new to them. And for many patients, it's entirely new. This office and my office, we've been doing televisit encounters for years, primarily for lazy people who don't feel like getting out of their chair and coming to the doctor. And I'm saying that in a very tongue-in-cheek and supportive way. But now it's an imperative because all of us have to shelter in place. And it's extremely important that we maintain good health. So we have to see that our encounters with our doctors are maintained. However, those televisits need to be done within a HIPAA-compliant fashion. So when you're scheduling an appointment for yourself or for your loved one, mom, dad, any of your children, always make sure that that encounter is handled within a HIPAA-compliant platform. And your physician should be able to tell you that yes or no. So you need to make sure that you ask that question whenever you are scheduling a virtual visit, a telehealth visit. Because what that means is that everything that we discussed, everything that we talk about within the context of the televisit is entirely protected, is entirely private, and is hack-proof. And you may have heard the administration, President Trump saying, oh, we're opening up all the laws, we're opening up all the rules, you can go in and you can see your doctor any way you want, Zoom, FaceTime, MobileMe, 2 cans and a string. Sorry, it doesn't work like that because those types of platforms do not assure you the privacy that you are entitled to and that you must have when it comes to critical health information, as well as your personal identification parameters, which are there in the health record itself. So it's very, very important that when making an appointment with your healthcare provider, you always say, hey, doc, is this a HIPAA compliant platform? Because if it is, we're good to go. If it's not, then you have to ask that doctor to activate a HIPAA compliant modality. And nowadays, as I've said, this type of televisit encounter, it's new for patients, it's new for certain doctors, not new for me because I've got a lot of patients who just don't feel like driving to the office, so they're old pros at the televisit methodology. But for those of you who are new to the experience, and I think this is going to be a new normal, I think that a lot of us are getting used to having a virtual visit with a doctor because it's easier. In many respects, it's cheaper, and it's just extremely convenient for those of us who travel or just can't make it to the doctor. So the televisit encounter is going to be the new normal for many of us, and I'm glad about that. But it's imperative that whenever that televisit is conducted, it be performed within the confines of the HIPAA compliance platform. And again, this is a federal statute. It goes back to 1996. And just recently, by fiat, by rule of the president, all of these parameters have been released, or I should say have been eased up vis-a-vis the COVID pandemic. But just because things are eased up doesn't mean that we have to let our guard down with regard to aspects of privacy and security. And that is why for those of us who are on the front line here, seeing patients each and every day, we make sure that those encounters are maintained within a HIPAA compliant fashion. So if you call on to my office, for example, any of us here at First Choice Neurology, our platform is entirely HIPAA compliant. And I'm not here to advertise the benefits of First Choice Neurology. I'm here to tell you that wherever you go, for whatever type of medical treatment, right now it's probably going to be done in a televisit format, you need to make sure that you request ahead of time. I want to assure that my teleconference is going to be conducted within a HIPAA compliant platform. It's extraordinarily important. You know, HIPAA does a lot of things for a lot of people. HIPAA not only assures privacy, it also assures that you can take your health insurance with you if you lose your job or get another job. It also puts the insurance companies on notice that they just can't distribute your health insurance, your health information all over the world and publish it. So it keeps everybody within a very level playing field of making sure that everything is done safely and securely. One of the issues about HIPAA that some people argue with is, hey, if I've got somebody down my hallway in my apartment house who has corona, how come I don't know about that? How come the administrator or the manager of my condominium doesn't tell me if Joe Blow down the hallway has a corona infection? I demand to know who in my building has corona. Nope, that's not going to happen because that would violate the federal statute of HIPAA. It would probably also violate the Americans with Disability Acts. And for those of you who follow me on Facebook, back and forth, there's been a lot of discussion recently about naming or identifying our neighbors, our friends, our colleagues who have COVID. A, that would be entirely a violation of HIPAA. It would be a violation of health privacy. And B, it could possibly be a violation of the Americans with Disability Acts. So therefore, HIPAA is a system that's in place for all of us to make sure that however we interact with our doctors, with our insurance companies, with the hospitals, with nurses, with pharmacies, that all of that is kept private and secure. And that also extends to people who are living down the hall in your apartment house, people with whom you work. So the HIPAA statute is an all-encompassing statute that forces us to watch ourselves when it comes to adhering to best practice to maintain extraordinary privacy. And I embrace HIPAA. And just recently, there's been, I think, this release or opening up of all these different platforms that could potentially allow you to interface with your doctor on Facebook or Instagram or MobileMe or Zoom or Skype. I don't agree with all of that because I think that that exposes both you and your provider to a real privacy risk, and it also is an open gate to allow any hacker to come in and compromise very valuable information that could be detrimental to you. So it's important that however you interact with your doctor, that you insist upon a HIPAA compliant platform. And this is more important now than ever. And just because we're under attack in a pandemic doesn't mean that we can let our guard down with the things that are required to maintain best practice of privacy and best practice of healthcare. So that's the main reason why I wanted to share with you this important information about HIPAA compliance, because HIPAA compliance is something that even in the darkest of times, in a pandemic, we need to make sure that we are adhering to best practice of privacy. Now, I've got some questions that are coming forward. First question is from John. The antibody study in DADE that is being conducted by University of Miami. Is this a worthwhile study? As this relates to HIPAA compliance, I want to remind you that aggregate data, mass data collection, is never a violation of HIPAA as long as personal identification information is not released. So if somebody comes to my house and wants to check an antibody, a COVID antibody level on me, or if somebody's going into my apartment house where I live on Miami Beach and wants to check everybody to see, A, if there's anybody who's positive for COVID or anybody who has an antibody response, meaning they've seen COVID, they've been exposed, but they're not symptomatic. Is that a violation of HIPAA? Absolutely not. And in fact, the Public Health Service, the health department, can go in and test people for infectious disease by mandate. And as long as personal identifiers are not located on that data set, as long as they don't say Jeff Gelblum, Miami Beach, as long as they don't say that, then it would be considered HIPAA compliant. Because remember, there's an overwhelming need for public health safety. So the Public Health Department can come in and do things, but they're still constrained by HIPAA. That information does not make it public. So one of the questions that I've just been addressing is, would broad spectrum antibody or broad spectrum COVID viral testing, would that be worthwhile? Absolutely, that's worthwhile. Because if you are COVID antibody positive and you're feeling great, then that means you've probably been exposed to the COVID. And we know it's been here since January. We know that it's been in the United States since January. So if you have that antibody positive status, then you're the first one that could probably safely go out and go back to work and help restart our world. So I am an extraordinary proponent of broad testing. I think everybody should be tested. I think everybody who is symptomatic should be tested for the COVID virus. And now you're seeing more and more spots open up in communities all over the country that are allowing drive-through testing. Again, it's been a slow uptake, but it's getting there. A little bit too late, but it's still getting there. And I'm also a big advocate of COVID antibody testing because a lot of us have been exposed, not myself, I don't know, because I don't have access to the antibody test, but a lot of us have been exposed and we don't know whether we are immunized against the COVID virus or not. This would be very, very important information. For example, just yesterday I had a patient. Now, he is likely COVID positive, and his wife, who he's resided with for the past, many years, but just been sequestered, isolated for the past 10 days, she has absolutely no symptoms. Now, he's symptomatic of headache and a little bit of a nighttime fever and some swelling, but the wife, nothing, absolutely nothing. Those are the types of individuals that really should get an antibody test. I would definitely like to test the wife if the antibody test were broadly available, because that way I could say to her, listen, you got it. Thank heavens it was nothing serious. It didn't cause you any disease. Go out and get back to work. The husband obviously is still symptomatic, so he needs to stay home. But it's important that we have this antibody test because with the antibody test, we know who is immune and who would not be immune. So the issue is getting back to HIPAA. The Public Health Department, public entities can do whatever it takes to maintain good surveillance of public health status to make sure that society as a whole is very safe. And they can do all of this within the framework of HIPAA compliance. Antibody positivity, if it were ever revealed, is not a barrier to HIPAA. So if one were to say, hey, I'm antibody positive, I'm asymptomatic, I want to go back to work, that's not a HIPAA violation, because whatever you do personally with your health information is your own business. Would it be a caveat? Would it be a rule that only antibody positive people can come back to work? That's an interesting point, and that is something that I'd have to throw back at the health attorneys who are watching today, as well as the disability attorneys, because theoretically, I don't think that you could discriminate in the workplace against people who have a disorder such as COVID or positive or negative. The point is, the antibody positivity would give us all a lot of reassurance that we are probably immunized and that we are safe to venture out. Whether this would be a prerequisite for employment, probably not, because again, that would probably violate the Americans with Disability Acts, where you're not allowed to discriminate on the basis of a health status. But again, the utility of broad spectrum antibody testing is inescapable, not from a personal perspective, but from a public health perspective, because this way we'd know how many Americans have been exposed to the virus. And a lot of people estimate that of over 300 million Americans, probably by the time we're done with all of this, you will have about 100 to 150 million antibody positive people. And that's a good thing, because those people now have good immune capability and can probably restart the country when it needs to get restarted. So the concept of HIPAA protection and antibody status against COVID, it's an evolving type of dialogue where we always have to trade off privacy versus the ability to go out, get back to work, and re-engage. Purpose of today's discussion is really to remind you that HIPAA is, I believe, a wonderful statute that assures all of us that our health information is not going to be published in the Miami Herald, that nobody's going to wake up and see your medical record somewhere on the street, and that it's not going to be used against you in any way, shape, or form in a court of law or for any other situation. I also want to remind you that HIPAA protection applies even to the dead. So if a loved one succumbs to COVID or succumbs to any disorder, even that information is protected. So if someone in your family or a close friend passes away and you say, hey, I want to know what grandma died from, unless you are the executor of that estate or functioned in some way as that legal guardian, you have no right to ask, because even the health information of the dead is still covered by HIPAA. So HIPAA is there to help us in life, but it also protects us after we're gone so that nobody can access our medical records and do something untoward with that information that could somehow hurt our reputation or somehow interfere with the aspects of our offspring and the benefits of our estate. So again, HIPAA is a legal concept that is there, that interfaces each and every day with us practitioners, with insurance companies, with hospitals, and you're living it in real time now in your apartment houses, where you're asking the manager to say, I want to know who's who's COVID positive in my building. Sorry, they're not going to tell you, and they shouldn't tell you, because it's a terrible violation of health privacy. And all of this is geared not only to protect you as the patient, but to prevent discrimination and further financial harm. So HIPAA is a great rule. It's been around for 24 years. Nothing's going to overturn it. Even if the president says, oh, you can Zoom with your doctor, or you can mobile me or FaceTime. Sorry, that's not the way it should be done. Any interface that you have with a healthcare professional should be HIPAA compliant, meaning privacy protected, and that's the guarantee of HIPAA. And I want to remind you that violations of that privacy carry very hefty financial penalties. The doctor can be fined tens of thousands of dollars, and then even you as an individual, if you try and go in and access that information can also be fined tens of thousands of dollars. So HIPAA is an extraordinarily powerful, empowered doctrine, statute that serves all of us in the United States to make sure that our health information is protected, that our medical records are secure, that nobody can take our information and do with it as they please. And that statute applies to covered entities, which would mean doctors and patients. But if that information is released, then of course there's liability outside in the community as well. I'm not an attorney. I can't tell you what the specific penalties are, but if you look it up, you will see that the violations of HIPAA go into the tens of thousands of dollars and extraordinary sanctions if one is a healthcare provider. So in summary, purpose of today's discussion today, of today's Facebook Live, is to say all of us are going to be doing a lot of televisiting with our doctors because we are in a shelter-in-place framework right now. And a lot of us going forward may actually like televisiting with our doctors going forward because this has opened up a new platform whereby you don't necessarily have to leave work for a chronic condition. For example, if I have a patient who's got a stable migraine disorder or a stable epilepsy disorder or a stable Parkinson's disorder, certainly that patient can conduct a televisit. There's no reason for them to have to schlep to the office, pay for parking, all of these things, when we're there to discuss a stable condition. So televisit, telehealth is the new normal, and it's going to be with us probably forever. And as I've been saying all along, this COVID is a transformational moment in our society. Things you thought you didn't need, you really may not. And things you do need, you may need forever. So televisit is going to be part of our healthcare system for many, many years to come now. And that's why I want to make it imperative to all of you that however you engage with your doctor, your first question when you call to schedule that appointment is, will my televisit be HIPAA compliant? Because without HIPAA compliance, you might as well take all of your information and throw it out on the street, because that's how porous other systems can be. Zoom, FaceTime, MobileMe, Skype, all of these systems are extremely porous. And one final mention, many of us are Facebook friends, and I embrace that and I love it. Don't ever Facebook message your doctor when it comes to health questions. You might as well just be calling Mark Zuckerberg and all the other advertisers saying, hello, I need to speak to Dr. Gelblum about my migraine attack, so please hit me with 1,000 ads for migraine medication and make sure that you now database me in some type of health profile that we know that all of these social media organizations keep. So to messenger your doctor with regard to health information, health questions, medication concerns, requests for refills, you might as well just be calling Mark Zuckerberg, and please advertise this on the San Diego freeway, because that's how private that communication will be. So purpose of today in this era of televisit, of social media, of Facebook, of internet connectivity, is to remind all of you that HIPAA compliance, HIPAA is probably one of the foundations of good health care, despite what has been said by the president about relaxing all of these constraints. But good HIPAA compliance is the foundation of good health care. So therefore, whenever you're making a televisit appointment, first question out of your mouth is, I need to see Dr. Gelblum. I don't want to come into the office. I think it can be handled via televisit. Is Dr. Gelblum's encounter with me going to be HIPAA compliant? And that answer should always be yes. So good question to always ask your healthcare provider. Make sure that any interaction you have with your insurance company, with the pharmacy, with any other entity such as a hospital, insist that all of those points, all of those discussions, all of those evaluations be rendered within a HIPAA compliant fashion. And then, of course, when it comes to public health survey, remember, public health entities have the ability to survey and determine prevalence. And if they come and ask you for health information, if they want to get a COVID antibody level, that's great, but be reassured that personal identification parameters will not be published or will not be collected, because that would violate HIPAA. So the government, with all of its health information acquisition right now, is still adhering to good HIPAA compliance guidelines. And this is not guidelines, these are statutes that the government is adhering to good HIPAA compliance. So on that note, we've shared a lot of information about this HIPAA statute, HIPAA, Health Information Protection and Portability Act, going back to 1996. It's been codified in law for almost a quarter century, and I think it's a good thing. And I wanted to share that information with you today so that you know more about this important statute that protects you and me when we have our dialogues and when we have our encounters. So if you need a HIPAA compliant neurology consultation, I hope you'll feel free to consult with our office, because we're in the business of taking care of all of your neurological disorders, myself and my colleagues. And rest assured that any encounter you have with me is always HIPAA compliant. And as I always say, if you want to ask me about health questions on Facebook, make them general. Otherwise, to me, Facebook is good for sharing pictures of lasagna and our dogs. But when it comes to anything personal, Facebook is not the platform you want to share it on. But I have shared some good information with you this afternoon, and I hope that you'll take that information, share it with your family, share it with your friends, and make sure that whatever you're doing as relates to your health care is HIPAA compliant. And I look forward to seeing all of you again real soon. And probably our next topic sometime next week will be a discussion of how COVID-19 specifically interacts with the nervous system, because there's very interesting information saying that the COVID virus is not just an upper respiratory syndrome, but can actually impact the central nervous system. And some of the first things that you've heard about are loss of smell, loss of taste, but COVID in many respects can do more than that. And we're going to be discussing that at our next Facebook Live. So I look forward to sharing that information with you probably sometime next week. But keep your eyes on First Choice Neurology Facebook Live updates, because myself and my 50 other colleagues, or actually we're up to 100 colleagues right now, 50 offices, 100 colleagues, we're very eager to share with you all of this information as it's coming forward. So on that note, if you're Jewish, I wish you a happy Passover. If you're Christian, I wish you a happy Easter coming up. And if you're Muslim, I just wish you a peaceful and safe day. And if you're agnostic or atheist, I just wish you happiness and safety. And I look forward to seeing you again real soon, knowing that all of our discussions will be HIPAA compliant. So I wish you all a great day. Have a safe weekend, and we'll be back in the near future for further discussions. And please, if you have any questions, feel free, general questions, not health-specific questions, feel free to contact me on Facebook, or feel free to post them on our website, firstchoiceneurology.net. And we address those questions and get back to you as quickly as possible. Okay, love to all of you. Wishing you a great and a safe weekend, and we will see each other again real soon. Have a great afternoon.